sorry to put you on the spot, Katrina. Katrina, would you be able to stay till the end of the scheduled meeting time today, or do you have to leave early?
I have to be in Red Hook at 6, so I was thinking I had to leave 5 minutes early if we took it to the end, actually.
Okay. So, so we had some meeting minutes and some commissioner applications. I was gonna propose we move it to the end. Why don't we do the meeting minutes now, the top of the meeting? And then if we wanna talk about commissioner applications at the end, whoever's here, we can have that discussion. I'd like to sort of suggest doing an executive session, because then we can talk a little more freely about applications and not feel any awkwardness about, we could just try to keep it a little bit more. Yeah, for sure. Great, okay, so, but as always, let me go to the top of the agenda. Let's do a round of introductions as we usually do. And we'll just make it kind of brief today. Your name, your pronouns if you'd like, if you're part of an organization or not, that's fine. I'm gonna start with the screen tonight. Sarah, since I see you're tuned in, do you mind introducing yourself? Then we'll go around the room.
Hi everyone, I am Sarah Brainerd. I work in software in New Paltz or at home now. But I work in the healthcare world with that. And I am also a Kingston Land Trust board member and Green Line committee member, and excited to still be here.
Yay, thank you, Sarah. I'm gonna go from Anthony all the way around. So Anthony, would you like to introduce yourself?
I'm Anthony Fitzpatrick. I use the he, him, L pronouns.
Great.
Hi, Marsha Sebro, project manager, Health and Wellness Department, City of Kingston.
Thank you so much.
Lori Ferguson, volunteer at People's Place, nutritionist and nurse.
Fabulous. Susanna.
Susanna Callahan, she, her, hers, Institute for Family Health.
Kristen.
Hi, I am Kristen Kessler from the She Parrot, project manager, Department of Health and Wellness.
Katrina.
Hi, I'm Katrina Williams. I work at the Ulster County Department of Mental Health. I'm the deputy commissioner, and I use she, her, they, them pronouns.
Hi, I'm Heidi Kirshner. I'm with the YMCA and I use she, her, and pronouns.
Thank you. I'm Emily Flynn. I'm the Director of Health and Wellness for the City of Kingston. I use she, her pronouns. Thank you all. I'm going to jump us right into some of the administrative things. And there's approval of minutes. Commissioners, we have 4 meeting minutes to go over: October, November, December, January. I have printed out versions if you'd all like to look at them. I can also hear a motion to accept them all if you've gotten a chance to review them. Those are your options.
I make a motion.
I'll second.
Thank you. All in favor?
Aye.
Thank you all. Sarah, I saw your wave. Thank you so much. Okay, great. Thank you so much. All right. So as we mentioned earlier, we're going to jump past the commissioner applications for now and try to get to that at the end of the meeting. So that brings us to an assessment. So y'all, I put together a bit of a presentation here. I've allocated 30 minutes, but we'll see how we might get through it faster. Let's see. Get there. And let's see, I'm going to start by saying,
Susanna
so I tried to collect a bunch of data about health. It's that kind of a little bit inspired by the county's that stats of the system, you know.
I love it when I emailed it. I was like, Marsha's gonna love this.
Oh my
I help myself, I love it.
A little bit of inspiration about that, except that we didn't focus so much on what we accomplished, but sort of a trying to do a snapshot a little bit. And in fact, I grabbed one of your screens, it's in there, you'll see. But so the purpose of looking at this is, we have not had this as part of our usual agendas. This is the first year that we've sort of set aside time to do sort of a health assessment for the City of Kingston. I've collected data from different sources that I've been hearing about for the last couple of years. This is by no means exhaustive. There's a lot of data out there. I tried to pick things that either looked like a spike compared to other counties around us, or a spike compared to New York State, or if you'll see, so some of that is just doesn't completely relate to our work. And then some of the data you'll see, clearly I picked it up because it relates very specifically to our work. Now, as you'll see, the first screen says the purpose of Livable Kingston. So I have that up as a great suggestion from Kristen to ground us in, for a moment, I just want to remind us all of what our purpose is here. So when we think about this assessment, we can think about how we might want to apply it, how we might want to use it. So the purpose is to facilitate policy, environmental, and systems change. I'm going to pause there for a second. We've talked about this, but I'm going to bring it up again, just so we're all on the same page. Policy, there's different forms of, this council can provide legislation for the Common Council. Environmental, to me, that is designing environments to encourage healthy behavior. Systems change, so these are the methods, processes, we can create guidance for healthy living. So all of those things, policy, environmental, and systems change, sometimes that's referred to as PES, that result in a healthy and active community through partnership and collaboration by not too little amount of stuff here. So I abbreviated it. So I sort of distilled down these wordy bullet points. So we can do policy, environment, systems change for collaboration to educate, to conduct research, start initiatives, advise the Common Council, elected officials, boards, committees, staff on issues and topics related to healthy living. We can promote access to resources, coordinate and facilitate the acquisition of grants, and create synergies among organizations. So I'm going to through that pretty fast, but sort of what I'm trying to lead you through here is that if we look at this health data and we want to make a recommendation to the Common Council or to staff members, or if we decide we want to start a new initiative within reason, a pilot program or something, we can do that, or we could ask the council to consider starting a pilot program, for example, something like that. Any questions about that role? Okay. All right, so now I'm going to get into the state of health in Kingston. So I started first by the county health ranking. This is a pretty established set of data. I think it's the Robert Wood Johnson Foundation does all of the counties in the United States. This is of New York. So Ulster County is the 24th rank of 62 in New York. So the lower the number, the better. I've tried to make the data pretty abbreviated here. For each data point, you can dive deeper, or if you have specific questions, I can try to find them out for you. And I'm not an expert in any of these, but I could try to explain them a little bit if possible. But this is pretty high level. In that county health ranking, what I thought was important was the food environment index. So Ulster County is considered a 7.9 of the food environment index. New York State is 8.9, so we're not quite as good as New York. What I also thought was very interesting there was the access to mental health providers. So in Ulster County, that ranking says that there's 260 health providers to every person. And in New York, it's a little bit better. So
There's a food environment means here, that definition.
my understanding of that is a positive food environment. Kristen, of course, correct me if I'm wrong. My understanding of that is that it is assessing the amount of people who have access to healthy food within a certain mileage within their community.
Okay.
So Punkaki, for example, has been considered a food desert. And so that's probably part of our food environment index.
Wouldn't the mental health be inverted? There's 260 mental health professionals for every
Oh,
one person.
no, yes, I flipped it.
Yeah.
Okay, so the lower would be
Yes.
better, right?
I must have goofed there.
Yeah.
No, absolutely.
Okay.
It's right.
Like, that'd be great.
No, so clearly I goofed on that, yeah. My apologies.
No, I wanted to check those.
Yeah. And so that's really the only time that I sort of mentioned mental health providers, so I put your slide next. And I'm not gonna go into all of that data, because we have wonderful Katrina here who knows that data better, and also, there's other organizations that are tracking that in our county. So in some ways, I feel like we don't have to do that deep dive in that data. But there's some important things that we should be aware of here. Is there ones that you would like to call attention to?
Suicides are way up. I mean, they're relatively flat over the last several years. The average is 25, I believe, but they're up to, so that this is like end of year data, right? So a lot of these numbers reflect 2023 totals. We had 30 suicide fatalities in 2023, which was up from only 18, forgive me. But then we had 18 fatalities in 2022, so that was a significant uptick. Opioid overdoses were up slightly. They've been relatively flat, increasing. We were up 5% in 2023, but fatalities were down almost 19%, which speaks to the harm reduction efforts that are happening. Access to care remains an issue. I mean, we do have a lot of fluctuation in our clinic treatment because we've got the lovely urgent care walk-in center 2 doors down at 368 Broadway, the Access Supports for Living runs, where people can walk in and get services right away. But most of our clinics have a month to a 5-month wait list. So, that remains a serious concern.
So the access, Katrina, is specifically for services via mental, via
The clinic, yes, these are mental health, yeah.
Do you have any idea how many of those suicides are gun related?
The vast majority of our Ulster County fatalities are gun related. Yeah, I don't know the exact number, but it's the vast majority. I would say it's 90-95%.
There's actually just an article today in the New York Times about suicide in the country and how we are vastly different than other comparable countries. It's gone up rather than down. And not only is it gun related, actually bridge related. It's taken decades for the Golden Gate Bridge to actually put a net, which has already stopped suicides for, dramatically overnight. And now lots of other cities and places around the country are adopting this and anticipate seeing a decrease. So gun fatalities and bridges.
Yeah, we don't see a lot of, we see the train.
Oh, yeah.
The bridges are one of our lower numbers here. And it's believe it or not, it's obscuring the landscape is a concern. I mean, that's what stopped, San Francisco for all of those years, is the concern about it, just taking away the aesthetics of the bridge.
Thank you for that. And I think you'll see there's going to be some echoes of some of this data. So we'll move through it and then we can come back to these, of course, if we want to dive deeper. So the New York State Prevention Agenda Dashboard, this is the New York State Department of Health, and these are all Ulster County indicators. The way that they categorize these, the 3 on the left are indicators of health that are of high concern and worsened. And so percentage of children with obesity, age 2 to 4, and these are specifically youth participating in the WIC program. That must be where they collect the data. Overdose deaths involving opioids, and emergency department visits involving opioid overdoses. So there's an echo there. Then the next set of indicators is high concern with no change, so flat. Percentage of adults with health insurance, percentage of adults with chronic conditions taking a course to manage their condition, hospitalizations due to a fall over 65, pedestrian fatalities, percentage of women with preventative medical visit, percentage of 13-year-old adolescents with complete HPV series, and then early syphilis diagnosis. So this is a dashboard of indicators that I grabbed that don't necessarily align with our work, but I just wanted to show that these are the categories that have been considered high concern for Ulster County. The BRFSS reports is a series of PDFs that the New York State Department of Health has sort of taken each category or indicator of health and created a kind of a one-pager. And so I pulled these out from various reports that are sort of aligned with our work. So Ulster County food insecurity is 13.4%. It used to be 10%, lower is better. So food insecurity, this indicates, has increased. So less people have, access to food. Ulster County adults who consume no fruit or vegetable, I think that was per day, was 31.3%. It used to be 22.9%. So it's getting worse. Less people have access.
Isn't that interesting?
Ulster County prevalence of obesity, 30%. Used to be 28% in 2018. 30% in 2016. So the graph is a little bit of a jumping around, but so either holding steady or getting worse. Ulster County active transportation, 67%, that is an indication of people who said that they walked 10 minutes in the last month. So 60, yeah, I think it's only 67% said that they walked 10 minutes in the last month.
10 minutes a day?
Month.
In the, what? They walked, they walked 10 minutes.
Per day, per month, just 10 minutes.
My understanding.
Straight.
Straight, they walked a 10-minute block last month. This is my understanding of it. I can go back into the data if you really want to dig deeper, but that was my understanding. It used to be 69.7, so it's gotten a little bit better. So a few more people said that they walked 10 minutes.
That's a weird metric because it doesn't even tell you anything based on what the recommendations are for physical activity, you know what I'm saying?
It tells me something for a start.
I know. But it doesn't, you know what I'm saying though, like
I know.
like the CC recommendations for exercise are like, what is it, like
30
3 times a week,
minutes or
30 minutes at a
10
time or something? So for that to call it active
Here,
whatever.
I can try to,
I think we need to believe that it's not true. I think we need to
I second that. Your phone can get that information really
It's
quick.
scary.
Yeah.
I might be able to find it quickly here. Let's see. Active transportation. And no, and I really appreciate the questioning, because I do want to make sure that I am understanding it correctly. And I forgot to say this at the top of the meeting, I am not a health data analyst. And so this is my, quickly trying to pull this together. So regular, let's see, gotta move these things out of the way here, I can't see it. Okay, 66% of adults reported walking for at least 10 minutes to get from one place to another in a typical month, and 10% reported biking. So their language is for at least 10 minutes to get from one place to another in a typical month.
I guess my only, people that walk for exercise might not have said yes to that question. Like, this has more to do with like how you get around.
Transportation.
Right.
Active transportation. So maybe that's the part maybe I forgot to say.
Okay.
It's about transportation, not leisure. And there is other reports about leisure activity.
Got it.
I think I have in the slides. Okay. So thank you for that clarification. Let's go back to this assessment. Right, okay. Ulster County Racial Equity Report from 2022. I think this is still very valid data. The comptroller published this report, so I think that we should keep considering this data. 23% of Black families fall below the poverty line in Ulster County, 17% of Hispanics, and only 5% of whites. The highest prevalence of obesity, 50% of Black, 45 Hispanic, 43 white. So just big discrepancies there. Premature death, 64% Black, 56 Hispanic, 40%. So 40 versus 64. So if white is 40%, this is pre-COVID data, to 64% of Black. So these are premature deaths. Motor vehicle related mortalities, 17% Black, 8% white per 100,000 population. So these are sort of the discrepancy in health for Black people in Ulster County.
Does the racial equity report list out race chronic diseases? Because I know that the BRFSS reports how that rates like heart disease, diabetes, hypertension. And I'm curious a little bit more about those than like any sort of like weight-based metrics. I'm curious. I feel like also diabetes and heart disease I know typically is higher in Black and brown communities.
I don't recall if it does or
In
not.
Ulster County, for women, it's the #1 cause of death, is heart
Heart
disease.
disease, yeah.
So
And the country too.
Yeah,
We can dig deeper into that. I thought it was that report.
Yeah.
those are pretty
Shocking.
shocking numbers. Shocking.
Alice, in case you aren't all familiar with Alice, it is a category, it's a way to look at, close to what is considered poverty. So Alice is asset limited, income constrained, employed people. So sometimes, so it's households that earn above the federal poverty level, so the federal government doesn't categorize them as in poverty, but they are asset limited and income constrained and they're employed. And they cannot afford the basic cost of living in their county. Despite struggling to make ends meet, Alice households often do not qualify for public assistance.
Who produces
The
this?
United Way.
Anyway, okay.
I never heard of this. That's
Oh, yeah,
interesting.
it's
Yeah.
really interesting.
Yeah, they publish it, it looks like very often. This is from the 2022 report, I believe, 2023 report. And so a positive number is that it reports that Ulster County had a 10% decline in the Alice population.
That's probably because the New York influx.
Mhm.
That's one thing, that's what popped into my mind. We don't have that, we don't have that exact link, but that could be. The other thing that, so it compared in this presentation that we watched, it compared our region. So it looked at that, it broke down the Alice people from Westchester, all counties around us. And one of the things that they pulled out that was important for Ulster County was the cost of rent. So the cost of rent in Ulster County was higher than in the other counties in our region.
Is that how much higher it is, or that's the cost of rent? Because I don't agree with that number.
Yeah.
That's
it's
low.
Yeah.
I think they reported that that's the,
Median.
Differential?
Yeah,
Maybe.
that's how it
Maybe
is.
median?
Maybe.
I'd have
That's
to
what
pull
they
up the
need to
document.
fix rent, that's how much they're short.
Yeah, if that's what they're short, then I would agree with that.
Yeah. What's do you know what the overall percentage of people that are considered Alice in Ulster County is?
I do not have that number, no.
It's shocking what Alice is for a family of four.
Is it self-reported? Are Alice people self-reported, or is it based on a formula that they look at, like the cost of rent and food and then look at the median income?
I don't know their methods for the data,
Yeah.
so I didn't
Yeah.
dive that deep into each metric.
I'm just kind of curious.
But I have the link here and I'll send this all out to you. You can all dive deeper. The presentation and the reports for this, Alice, are really rich. There's
Yeah.
lots of data. They break down like what is a budget for each count, like for a
Oh.
person living in each county. So there's really great data there if you want to dig deep.
Yeah, so they probably look at what the average cost of rent and the average cost of a basket of groceries and the
Yeah.
average cost,
Exactly, and they include
Yeah.
phone, utilities.
Uh-huh,
It's very interesting information. The last point there that I pulled out was that 53% of renters pay more than 30% of their budget on rental costs in Ulster County. So,
we know the federal poverty level is ridiculous, like.
Yeah, it is. And I mean,
I
you
mean,
see the staunch difference between Alice and the federal poverty level. You're just, I can't
What
remember,
is it,
but
like
I was shocked.
$6,000 per family of four? Is that what it is currently?
Yeah, and Alice is like 70 something, 75, 76, maybe higher. Shocking how much it costs to live for like a family of
Yeah.
four in Ulster County. Kingston is even a little higher compared to what the federal poverty is. So it's just, it's such a drastic difference
Yeah.
of living expenses compared to other parts of the country.
the community health assessment, this is an assessment that the Ulster County Health Department, along with the hospitals, they did assessment with the other county, the other county health departments in our region and the other hospitals within our region, and did a super assessment report. But within that assessment report is some Ulster County data. So this is the 2022 to 2024 community health assessments. This is the one that we're under right now. So it's a little bit dated. It sort of gets up to this, the data that's reported in it sort of touches on COVID, but it doesn't really go past the COVID years. So I pulled out that 11% from 2022. So this is another food insecurity number. It's a little bit different than the other one, but it's in the same ballpark. It sort of shows the same thing. So In 2027, 10% of Ulster County was food insecure. And in 2022, it reports that 11% was food insecure. So it also reports that food insecurity, more people were food insecure. And they have graphs, and it sort of switches back and forth that Ulster County is the second or the third highest in the region. So not the highest, but wavering up and down between being the highest there. It reports that 6% of Ulster County population has limited access to healthy foods. That was from data from 2019, and it was reduced from 8% in 2015. So again, another indicator that access to healthy food is decreasing. This was the second highest in the region. So access to healthy food was decreasing in Ulster County, and it was the second worst in the region. Ulster County top rated barriers to better health. Okay, so this is self-reported. So folks reported that this was their top reasons that they had barriers to better health. Drug and alcohol use, knowledge of resources, geographic location in a rural community, and health literacy. So that was self-reported. And then self-reported top issue. This wasn't self-reported. This was sort of an analysis of all the data that Ulster County's top issues that affect health are housing, mental health providers, public transportation, and nutritious food. So I think you're starting to see these echoes, right? Different data sources are reporting sort of similar things. Then, so that was all Ulster County data. So that's where most of the data is, but we can dive down into Kingston now with the census. And just to remind everyone that our population in Kingston is about 24,000. Of that population, about 4,000 is of Hispanic or Latino descent. 15% of that population is over 65. Ulster County is 21%, so Kingston is a little bit younger than Ulster County on the whole. So about 8% is without healthcare coverage. Our employment rate is 63%. The median household income measured from the census data reports that 62,000. The census reports that 18% are in poverty and 23%, I'm not sure if it's 23% of the total population or 23% of the 18%, but we can try to find that out, is under 18. So to me, that means that 18% are in poverty and a significant portion are youth.
Right, I think that's what it's saying, 23% are youth.
Yeah. Then here's the active transportation part again. So transportation to work, less than 1% bike to work and about 4% walked to work. Okay, this is a graph, or this is some data that I actually made a long time ago, but I pulled it back up. I haven't shared this sort of publicly, but I think this is time. This is the life expectancy by census district in the city of Kingston. There was a 5-year difference in life expectancy. If you know, some of this might make some sense in the city of Kingston. The darker orange areas are parts of our community that in the past had been pretty under-resourced. The parts that are lighter yellow are, larger houses and seem to have more resources at their disposal. So I think this is important to look at our geographic location of where we might want to, anyway, I think that's interesting.
Mm-hmm.
All right, we get to the end. This was important to my transportation work. There's a 10-minute walk park score. The mayor has signed on to it. It reports that 71% within the city of Kingston has a 10-minute walk to a park. What's the good news about that is that data doesn't include the Green Line, the Linear Park, or Post Office Park, which will all increase that score. So it's underreporting here. I think that's my last slide. Okay, so I'm happy to go back to any of the other slides if you guys want to dive in deeper. Any questions about what's coming up for you? About how it relates to our work or themes or anything that's coming up?
What's that slide that had there was 4 items that basically were the ones that kept coming up. It was food access, can't remember what the other ones
Yep.
were.
I think it was opioid deaths. Let's see. So this is the Ulster County Health Assessment.
Yeah.
Oops. And it was the Ulster County Health Assessment said that the top issues for Ulster County were housing, mental health providers, public transportation, and nutritious food. And within our work sort of that's already established, the public transportation and the nutritious food directly aligns with travel well, eat well, and grow well.
Yeah.
So that's sort of the buckets of work that we are sort of already considering and addressing. So overall, I'd say I find most of this data to be makes me sad a little bit. And not,
Yeah.
there's my task wasn't to try to find positive things. So really, I was pulling out the things I thought were alarming. So it's there's positive things that are happening in our community as well, but I pulled out the things that I thought are important for us to know about.
Yeah, and also, it's hard to know on some of these how, because it's countywide data, not zip code specific data, right? So it's a little hard to know how much better or worse Kingston might be doing than, say, a really rural area in southern Ulster.
Right,
It could be skewed.
like
on
access to
numbers.
nutritious food, like I would imagine that was really different in Cohonks.
Yeah.
Yeah, like Gardner, Worson, they have a lot of, so it's hard, it might be skewing some of this too. It's hard to know. But there is enough data that's concerning, that's Kingston based that you presented too.
And I find, data is often a snapshot, or it's a number of the people who have decided to respond to a survey. And so I wouldn't use these specific numbers, I might use them in a grant application, but I don't think we should get too stuck in the very specifics of the numbers. I would suggest that we look at them more to see the big themes that are happening and some shifts over time. So, that multiple data sources are reporting some echoes here that feels stronger to me than did that number change half a point.
What else is in Ulster County? There's the city of Kingston, there's the town of Silvis, the town of Ulster.
So,
There's a lot.
Ulster County's huge. It's the size of Rhode Island.
Is it really?
It is.
I didn't realize
You've
that.
never heard that?
I
like
say
that
that.
Ryan used to say
About
that.
yeah.
Um,
Rhode Island's pretty,
it's
it's
much
small
larger
state.
ones in New York State.
It is.
Yeah.
It goes, as far south as New Paltz.
No, further.
Further,
Further.
Ellenville.
Ellenville, I think is
Like
west.
Yeah.
South
South
North
is
of
Marlboro.
Okay.
yeah,
Right? And
That's
that's,
the southernmost, right?
Is Marlboro,
in Ulster.
it is in Ulster, not
It's
Orange.
north of Newburgh, just north.
So just over the border,
Mhm.
okay.
and then up 28
Yeah.
to Bel
Very
Air,
west.
is in Ulster County.
Yeah.
Yeah,
So there's 182, almost 183,000,
Yeah. that's-
100,000 people in Ulster County, so the city of Kingston is
24.
24,000 of that.
Mhm.
What would it take for us to do a survey of
24,000 people.
Kingston?
So
Would that be worth the time and effort?
that's a fabulous question. Assessing and surveying folks is a conversation that comes up often. There's a lot of surveying that happens of the community, and so there's also conversations about trying to either combine surveys. So if there's other organizations or projects that are already doing surveying, that we could combine our efforts, or that we look at the data that's already out there instead of creating our own data. We have done surveys of different types and different data collection of different types in our work. It's a big project to do that assessment, and in some ways that Ulster County CHOP,
Means that they do it then.
they sort of do it.
They do it.
The county,
Yeah.
so it's on the city level, it's at the county level, that's part of their task. They have to do the assessment as part of the county health department. And they have experts that figure out what the question should say and how to calculate that data. I'm not that kind of expert.
Yeah.
So I don't recommend it, but it's something to consider.
Yeah, the problem with that CHOT survey, because we get involved in that too, it's all done through Siena College, it has a whole expertise.
Yeah.
But they do it by phone.
Yeah,
So
they
most people
robocall.
Answer the phone, they do robocall.
Landlines only, right?
Home phones,
Yeah.
and who has home phones anymore?
That really skews
Older
the data.
people,
Yeah.
right? And so it skews things,
Absolutely.
yeah.
I was going to share, I know that July has a hardcore member right now, and Judy connected her with me because I do primarily food and nutrition work in the city of Kingston. I know that Natasha was working on a nutrition security assessment because she's been tasked with that as part of her placement for hardcore in Kingston. So she does have the very specific like geographic boundaries of Kingston to be looking at for this nutrition security assessment. So just in my role, I've been helping to share with her resources and connect her to people and kind of help have a conversation with her on that, and suggested that she put something together and that we can bring it to Eat Well as the focus theme that is primarily focused on nutritious foods, to be able to receive any feedback from folks locally on the types of questions she'd be asking, the methodology that she has for doing this assessment. So at least in terms of like nutrition security, like that is a project that is happening, but it's only this year. So to Emily's point, she's doing it because, she said that is her placement.
Right.
So just to share, I know that we have that, and the food systems plan is also going to be doing some engagement in the Kingston community regarding food access.
That's great. So federally qualified health centers aren't required yet, but a lot of us do assessments around the social determinants of health. And we do ask and have to report on this, on food insecurity, transportation, housing, and we report on another one. We ask more than that. So, I mean, I could get numbers for people, the identified numbers just for people who live in 12401.
That's bigger than the city of Kingston.
Oh, it is.
Yeah.
Right. Okay.
None of these things align.
Yeah.
By how much?
Yeah.
Like, how much beyond Kingston is 12401?
Goes down to Eddyville and a little bit to Rifton.
Plus, we don't, it's mostly our social support services staff mostly do it, so not everybody's doing there. So, but we do, out of our 100,000 patients organization-wide, I think we had 27,000 assessments done around social determinants of health, which is a huge increase this year. So they're happening more and more. But, well, if you want, I could do that, yeah.
So it's about 5 o'clock. That was the time that I sort of had set aside for this. And again, this was the first time we've sort of done this discussion. So we are always looking for more data or other assessments. So please send that to us and we can kind of collect that. And I suggest if there's other data points that we think are important to cover the next time we have this discussion, I can try to record that for our next time. So I think that this was I hope you feel like this was a good start to have this conversation.
That was really helpful.
Yeah. Thank you all.
Thank you.
Yeah, so moving on,
Could you share those slides?
yeah, yeah. Moving on, I put a little bit, I'm gonna have Kristen talk about the food systems update for about 15 minutes, and then we'll move on to some of the other things. So Kristen, would you like to give an update?
Yeah, do you have the slides that the consultants?
Oh, I think I probably find that.
Yeah, that was in, a lot of board, I was just gonna kind of try to use that to guide.
Yeah. I can find that.
What to share, so the food systems consultants have started, on the plan, so they are kind of deep into their research phase of gathering all data, so continuing this conversation about data, gathering all data that they can, so that they can have a base understanding of what we already know, so that we can be very intentional and thoughtful about the questions that we still need to ask. And they are looking to gather input. I think they are very interested in the commission overall, just as the, health commission that is embedded within our municipal government. That's something that's pretty unique. Emily, this is perfect time because also Emily kind of reviewed the purpose of the commission, and those are really the objectives that, were in the resolution that formally adopted this commission. So I think they're looking to the commission as leaders in the community, and also ultimately one of their tasks is to take a look at the programs and policies that the city of Kingston has that might support a strong and resilient and equitable local food system, and then to make recommendations from there. And as a part of that, we included take a look at the Department of Health and Wellness and take a look at Kingston and see how are things operating, how are things working, what are some best practices from other, analogous cities or regions, and make recommendations on how we can best utilize all of our roles and responsibilities to support this local, resilient, equitable food system.
I see the email you sent me, but I haven't seen the deck.
Let's see, so I just say that because I think that's why they are, let's see. I'm not send you, well, doesn't matter. I'll just call it. I told them that there wasn't that much time during this meeting anyways. I thought, so they are, I think, they're very interested in the commission in that sort of way. I told them that I'd recommend that if you are interested in answering any of their questions, to attend our town hall that is happening on March 6th at 6:30 p.m. There will be flyers, there will be calendar invitations online. The Engage Kingston page will be updated. So there will be lots of information on how to do this. It will be largely a virtual presentation, but I will be hosting the meeting also in conference room 1. So for anybody who is unable to attend online, who does not perhaps have access to the internet, or for whatever reason would prefer to be in person, I'll be here at City Hall kind of hosting that. And that's where they'll go over the plan and then start to ask for folks' input on our food system. There's also going to be a survey that is online that people can go on and fill out the survey if they don't want to attend the meetings. If they can attend the meetings. There'll be plenty of different opportunities to engage. And in addition to that, they're hosting focus groups, so very intentionally curated groups of folks that represent different parts of the food system, with a particular emphasis on people who have been historically underrepresented in these conversations, or are, they're not experiencing as equitable access to food, to resources, because the food system also includes farmers and small food businesses and all that. It's not just our emergency feeding system, which I think a lot of people, that's where their mind first goes to when we talk about this food systems plan. So we'll have lots of in-person events. We'll be at Earth Fair this year in April. They're going to be at the farmers market with me in May. So we'll be out and about. And I think that their biggest question was just, are there any specific groups that we should be reaching out to? By we, I mean they, because we are paying them to do this and I am not doing it. Folks to be reaching out to, events to keep in mind, people to talk to, just kind of starting to do that overall gathering of information at this stage. So I think that's the biggest question. Or if you have any questions about anything that I've just said or shared. I can't believe I said that I forwarded you.
I know, I can't do
I get so many emails from these people. And I'm like, which is great because they're doing lots of work. Any questions about?
So you said the Earth Fair is going to be in March and May?
April.
Or March and April?
Well, Earth Fair is actually in May because we can't do it on Earth Day. So Earth Fair is a collaboration between the city of Kingston as well as a few other environmental organizations in Kingston. And so they will just have to have a table out because it's already happening. It's going to be in the Rindell. There'll be a lot of people there. So that's May 11th. And then we'll be at the farmer's market on opening day, Saturday, May 4th.
That would be the farmer's market.
Uptown.
Fourth,
And uptown, yeah.
and that's in April.
That's in May 4th.
Oh, that's the Earth Fair.
Earth Fair is May 11th. Yeah, so I'm just like back to back.
Can you say that out?
Yeah, so that's why all of this, one is going to be on Engage Kingston, so that's the city's website for all project information. We put things on Engage Kingston, and then you best believe I will be emailing everybody all the time to be like, this is what's happening. Show up to my events, take the survey, please.
Appreciate it.
Yeah. Yeah, so I have to update this with some of the dates that we know that are coming up, but this is like our Engage Kingston page. Right now, to be honest, we're basically just kind of telling people what a food system is. You know, I knew that would be kind of a question, but so far in the conversations that we've had, I've been surprised, not surprised. Folks, you know, are like, wait a minute, so what is this again? What are you doing? So I think there's going to be a lot of grounding work to be done to kind of set the conversation as we go forward.
If there's not a lot of questions about that, do you want to mention the email or the communications you'll probably send to the commission about the other food grant that you're doing, that might include the survey?
Yeah. So when I find these slides, I will send them to everybody. Because they made some slides and I was like, oh, we probably won't have time to talk about them. So I was gonna send them anyways to everyone. But also with the, so I emailed the commission as well as the eVol Focus team. There's something called the Better Food Policy Fund. And so that is the funding for food policy councils that is unrestricted for 2 years. And it sounds like there is interest and support and enthusiasm for this grant application. I think that, let's see, I have the grant that is opening. It is due in a couple of weeks, so I'm working on the responses. There's a couple of things there. One is that they are asking not as like a qualifier, you know, they just truly, this is a non-competitive grant. It goes, if you apply and you meet their like basic eligibility requirements, it basically is like a lottery. You know, but they are looking to try to create a diverse like cohort essentially for this. So they're asking for a percentage of your leadership and your membership that identifies as BIPOC, Black, Indigenous, or basically not white at this point. You know, we don't have that data because we never asked for it through Live Kingston. So we were talking yesterday about having some sort of survey that people can self-report to be able to start to maybe give us a little bit of that data just so that we can include it in this grant application for them. You know, so we've got that, and then, you know, there's one other thing, so let me bring it up real quick. So I didn't know that I would have time to talk about this one. So I need to go find where the application is. And then I guess there's just one thing, like, you know, they have on here, one of the questions is tell us about a shared vision for your food policy council has for the community. And I think this is a little hard because I'm writing it on behalf of everybody rather than, you know, like everyone writing it together. We also aren't like traditionally structured as a food policy council, which is okay. We still qualify as a food policy council. We have the commission and then we have Eat Well and even to an extent Grow Well because food policy councils often work in urban agriculture as well. So I guess I just wanted to share, you know, I was just writing things about taking the vision from the Eat Well Focus team and that, you know, our vision is that everyone is food insecure and healthy eating is the norm. That is literally the vision for Eat Well Focus Team. I did not make that up. I just will share with you how I wrote that. I think one of our biggest strengths is that we basically work really well together in a collaborative spirit of camaraderie because many of us are neighbors and friends. And we see each other for lunch and we sit on each other's committees and coalitions and we work well together. I feel like that is not controversial. Hopefully not. I don't know, maybe some people have thoughts on that. Sorry, I have like the sun in my eyes, so I keep thinking to the side.
And to tie it together, I was reviewing that community health assessment and Ulster County reported that they felt that the highest, one of the strengths that Ulster County has in the health world is the coalitions that we have. We have some really fabulous coalitions between the opioid task force, our Healthy Ulster Council, there's different groups working on many of these things. So that echoes what you're saying too.
Yeah. So I'm just working on that. So I guess, leaving it, if there are any additional questions about that application, or maybe perhaps any thoughts on this member survey, which, we're talking about including maybe just a few other questions since, we don't survey our members very much, and this whole idea of not wanting to over survey people to understand who is a part of the Livable Kingston as a whole, including focus teams, so not just the commission. I don't know if there's any, you're like, oh, this would be very interesting for us to know about the people who participate in this work. But it's like 5 questions, so it's not.
All right, thank you for those updates and information about the work that's going on there. If there's no other questions, I'll bring us back to a few things on the agenda, but I wasn't gonna spend too much time on them, but let me bring it back. So we had talked about, we reviewed the 2023 action plan already. And we talked about after this kind of health assessment, reviewing the 2024 action plan with that in mind. But we're running out of time tonight, so I'm going to propose that we move that to another meeting that we sort of review. And I haven't had a chance to sort of draft up that action plan. So instead of us doing it together, why don't I draft it up? You guys can give me your feedback at another meeting. I do want to point out the links here that are in the agenda. All of the focus team action plans. This is probably the earliest we've ever had all of the action plans sort of organized. So you as a commission sort of receive the reports of the focus team. So if you want to dive in to see what those groups are planning to work on in the next year to inform this commission, you're more than welcome. And you can click on those links and go into each focus team's world a little bit there. So I'm just trying to draw your attention to that as an option. Any questions about that?
Did you say that's the earliest that all of them have been?
Yes, by far. And in fact, we didn't have a travel one last year. So we're far enough, we're doing better this year. All right, so that brings me to the end of sort of the meat of our meeting. What I would like to propose is that the commissioners stay and we do some admin, which is talk about administrative matters. And I forgot, we haven't officially elected a chair for this commission. So that's something to touch on quickly as well. Unfortunately, that means that I'll ask Anthony to leave us, and Marcia and Kristen, you guys can go so that we can have sort of a smaller conversation about the commissioner applications and officer elections. Anybody have any questions before? I'll just say then our next meeting is March 20th, same time. We'll sort of transition then to a smaller group. Anybody have any questions?
You want me to come back?
No, I think that'll be, so we're gonna have a small meeting and then we'll be done in Sarah, if you don't mind staying on, that would be great, but I'm gonna stop us live streaming. Yeah, it's a great time to